Okay, thank you for coming. This is Craig Cudworth, our interim CEO.
Hello. I'm going to read a statement and then we'll open up for questions. Good afternoon. My name is Craig Cudworth. I'm the interim chief executive officer for Trios Health. Thank you for being here. Today, Trios Health completed the implementation of a workforce restructuring plan that's resulted in staff changes effective tomorrow, April 1st. As many of you know, Trios Health has been in financial distress for some time. That's been well reported. As a perfect storm of national market forces, local competition, and the heavy debt of our new and needed hospital and outpatient facilities formed, the Kennewick Public Hospital Board of Commissioners hired an outside consultant to conduct a thorough analysis of the organization's finances, operations, and management team. Quorum Health Resources arrived late in September of last year. The conclusion of the final report by Quorum was clear. Trios would not be viable unless we made some significant and difficult changes. Following a board vote late in January, the Trios team came together to implement a comprehensive plan, which has been approved totally by the board. While ample progress has been made to implement all aspects of this plan, today we are focusing on the workforce restructuring effort. Payroll has long been Trios' largest single expense. It takes a large workforce to provide excellent and compassionate healthcare services for all of our community. We value every contribution made by our staff in caring for those who come to us for care and it is received in a compassionate manner. Unfortunately, in the workforce analysis, it became clear we had an opportunity to streamline our workforce in line with national standards and thus reduce our payroll expense. That is, we could be more efficiently in providing care while preserving the quality and breadth of our services. I need to be very clear here. We will not cut corners when it comes to providing quality patient care, and we will not cut corners when it comes to providing the well-being of our patients and also our staff. The recommendation was that we find a way to reduce our workforces by 92 full-time equivalents in our hospitals and 23 full-time equivalents in our medical group, for a total of 115 full-time equivalents. I need to emphasize one point for you. FTEs, or full-time equivalents, does not equate to individuals. An FTE, or full-time equivalent, represents 2,080 hours, which are worked in a given year. A part-time job can represent a fraction of an FTE in a shift as health organizations and in health organizations shifts are common. Our overall target reduction was set at 115 full-time equivalents. Our workforce team, which is here with me, has spent the last 2 months working to meet this target with a high priority on maintaining as many employees within our system as is possible. Effective first, we will have reduced our FTEs by 95, which will equate to a savings of $4.3 million a year. This has been achieved mainly through attrition, that is, not rehiring non-essential positions after people have resigned or left the organization. In addition, due to the extreme creativity and staff work of our team, we have been able to look at schedules and hours worked. Some staff agreed to reduce their worked hours, which helped significantly, and minimized our reductions, which have resulted in layoffs. The numbers you have detailed in your press release indicate the layoffs and reductions in hours and how that equates to full-time equivalents. I think it's very important that our community know and understand two things. First, there's nothing easy about this kind of work. There's nothing good about this kind of work. It hurts. It is, however, necessary. We have spent a great deal of time communicating with our unions and directly with our providers and staff. No one should have been surprised, as all have had the plan that Quorum was working on and access to it for several months. Each affected person was afforded the dignity and respect of notice weeks ago. But this is about people, and this is still a difficult time for all of us. Our employees are sad, fearful, and some may be angry. We all feel this on a personal level. These are our friends, our neighbors, and sometimes even our family members. What we can agree on is that we want to be here to serve the Tri-Cities for decades to come. And to do that, we must make some changes. Again, I thank you for your time today and appreciate the care which I know you will communicate this to our community. Thank you.